Okay, well, welcome everyone. I'm so happy to have all of you here. My name is Joellen Marsh, and I'm the Program Director for Connect's Law Enforcement Assisted Diversion, or LEAD initiative. And I'm just so excited to welcome you to Connect's Pre-Arrest Diversion Summit. I thank you all for joining us virtually and taking the time to learn about this initiative. You can go to our summit website for a glossary of terms, additional resources, videos, things like that. We will have videos posted there after the summit is over. And finally, just a quick introduction from my end. Connect brings together the city of Pittsburgh and 40 surrounding municipalities, and we work together to share, to identify shared public policy challenges and work across boundaries on solutions. We were founded by Dr. David Y. Miller in Pitt's Graduate School of Public and International Affairs, and we're fortunate to now be advised by our Dean, Carissa Slaughterback. Dave Miller was one of my personal mentors, and I know he was so proud of this work on LEAD, and I can't think of a better way to honor his memory than bringing so many people together to work on such an important topic. Before we start our keynote, I'm happy to share remarks from Otis Pitts, who is the Deputy Director for Public Policy and Community Relations at the Allegheny County Health Department.
Good morning. I'm Otis Pitts, Deputy Director at the Allegheny County Health Department. On behalf of our Health Director, Dr. Deborah Bogan, I would like to thank Connect and the Connect membership for hosting this summit and shining a light on pre-arrest diversion programming that will go a long way in improving the chances for better health outcomes for Allegheny County residents. As a result of the Health Department's CDC Overdose Data to Action grant, we have been able to foster this partnership with Connect and develop pre-arrest diversion programs throughout our county. In my capacity at the Health Department, I oversee our overdose prevention work, and I want to extend a special thank you to Lydia, Joellen, and Kelly for all the work they continue to do to get diversion programming off the ground here locally. It's because of their persistence and leadership that so many Connect municipalities have committed to implementing diversion programs and have passed local resolutions codifying their support for pre-arrest diversion programs. And as many of you are aware, pre-arrest diversion creates pathways leading to fewer decreased interactions between those with unmet needs and the criminal justice system. In light of the increased rates of overdose we've seen in both 2020 and so far in 2021, we need innovative programs like diversion to serve as timely connections for those with SUD. And as many of today's attendees are aware, both the local and national overdose crises continue, and in many ways have become even more complex during the COVID pandemic. Just as the COVID pandemic has laid bare some of the social issues that continue to drive the stark health disparities between racial and ethnic groups, I hope we're getting to a point in the overdose epidemic where there's a broader recognition that unmet mental health and behavioral health needs are a major component of our overdose crisis. Lastly, I just want to take a moment to thank the National LEAD Bureau for their continued leadership and always serving as a critical reminder that racial equity is at the core of this work, and that it's so important to be deliberate in our efforts to make sure that pre-arrest diversion reaches all communities, especially now that the overdose crisis is sadly impacting so many communities of color. Thank you again.
I want to thank Otis and all of the overdose data to action team at the Allegheny County Health Department. We wouldn't be able to do this work without you, and you are always so incredibly supportive. So thank you. And then the last speaker for our introduction session, I want to share a poem from a local advocate and community organizer, Jamar Williams. Jamar is the founder of Living on Purpose, an organization centered on teaching people about reentry, and he was generous enough to actually write us a poem about diversion to share today.
Diversion. It's more than just black and white. It's more than words on a piece of paper that are being typed. It's more than an act. It's more than a group of people coming together to plan out how to be intentional on matters that are intersectional. Matter of fact, 12 years is the age of the wrists that are shackled. It's more like a prelude to what more than a decade became. Adolescent years charged with parched and truant tears. Add to that system the injustice of seeing far too many fall, far too many gone, far too soon. Its weight heavy on the man, not to mention the lives, much like the tool used for engraving the tomb. Let us not fail to mention the parents of the stillborn, born yet still absent, leaving the heart to mourn. Heavy is the head that holds the crown. Heavy also to those who step into this responsibility. It's not a role. It's not a title. It's just one seeking to make a difference, a better me. And me? Well, I, of course, wish today could have been yesterday, or rather yesteryear. But then maybe I don't, because I wouldn't be here also seeking to alter the course of the river of tears and fears. So here we lock, committed and connected to diversion for the future. Hands steady, wheels ready, just wishing that
Thank you, Jamar. We'll be in the same Zoom meeting today until the very last session. At about 11:30, we'll be splitting into two groups. So one group will stay here for a discussion about community leadership teams. So stay here if you want to talk about community participation and organizing for LEAD. Everyone is welcome to stay, but this will be most useful for people with lived experience, community advocates, faith leaders, business leaders, and any other type of community level stakeholder who's really interested in the kind of community organizing piece. And then also our other group will follow me to a discussion on a different Zoom link, which will be posted in the chat now and a couple other times throughout the day. So hopefully you won't miss it. But that will be for our operational working groups, which is really for some of our systems partners and people who work with our systems. So that would be police officers and other first responders, service providers, prosecutors, probation officers, public defenders, folks like that. So we will have just two different groups there, and you're welcome to join whichever one feels most comfortable for you. Lastly, the entire Connect team wants to send a huge thank you to all of today's speakers, to the members of our Summit Planning Committee who worked so hard for the last several months, helping us figure out which speakers and how to organize all of this and bring it all together. A huge thank you to GISBIA and the PIT community, and to the LEAD National Support Bureau, who's been such a huge help with technical assistance all along the way, and who also provided marketing support through Two Hats. Funding for the summit comes through from the CDC through the Allegheny County Health Department. And most of all, thank you to Connect's member representatives and our partners who initiated this work on LEAD, to all of those who've been active in championing it, and everyone who's joining us today. We will now switch over into our keynote session. It is my pleasure to welcome our keynote speaker, retired Chief Brendan Cox, who is Director of Policing Strategies for the LEAD National Support Bureau. Please see the Summit's website for his full bio. And thank you, Brendan, for kicking us off today.
Thanks, Joellen. Good morning. It's great to be here with everybody. I want to thank you and your team, Kelly, Lydia, and Kaylee, for all the work you guys have been doing. And that was just amazing, the way to start off the day. Jamar's words there are about making a difference and what that means and what we all strive to do. Certainly in my past job with the Albany Police Department and police officers I talk to around the country, we want people that want to make a difference. And I think one of the key things and one of the reasons why we love at the National Support Bureau working with you and your team and all the folks in Allegheny County is the fact that you all want to make a difference, and we try to figure out how we make a difference, what it is that we need to do to make a difference, and how we've tried to learn from the past and do things different. And it's clear to us that everybody in Allegheny County wants to make that difference, and recognizes that what we know from the past, we can't continue to do over again, and we need to change. And it's very clear that you guys want to do that. And we just love working with you guys, and we love working with your region. And I've had the pleasure of getting to know folks from the Allegheny County area in my lifetime. When I was in college, I had a couple of roommates from Pittsburgh, and I know how passionate you all can be about your region, which is great. I love it when folks are passionate about the region. So let's talk a little bit about Allegheny County. We have some of our team on this call. You all obviously know your region, but you guys are home to 1.2 million people. You're over 745 square miles. You have 130 municipalities in your county, and what that says to me is that while you're a one big region that certainly has a regional thought process, you also believe in your independent and your independence of being able to have your own little places that have independence from the rest of the region. And I think that's important. Like, I think a lot of folks like to have their own identity within a larger provincial area, which is great. You guys have 109 police agencies, something that, we know across the country, that folks want to have their own police agency. Folks want to say, that is my agency. We're responsible for them and we know them. And then something with LEAD that we'll talk about more is that ownership and that collaborative approach and knowing each other and those relationships. You guys are home to Pittsburgh, the Steel City, right? How we all know each other. And you guys are known as the three rivers that flow into the region and become the Ohio River, right? The Allegheny, the Monongahela, which converge into the Ohio River. And as I think about that, and I think about the work that we're doing with you guys, I think about the fact that you guys are looking at this from smaller cohorts that'll flow into the main policy group of LEAD and flow into this larger think tank that's doing this greater work. But you guys are recognizing that these smaller groups on the ground need to do the work within their own region, and being able to share resources between the cohorts within the county that flow into that larger group, which I think is really kind of plays into those three, the two rivers that flow into that Ohio River. So I think that's really important. When I think about different cities and regions, unfortunately, I go back to either thinking of folks in one of two ways. I either think of music or I think about sports. And when I think about Allegheny County and Pittsburgh, I think about sports. And I grew up I was a kid in the 70s. That's where I know all my sports from, and where I ultimately became a fan of different allegiance to different sports. And in the 70s, growing up in New York, I didn't take to any New York fans. I like to argue with people. But in the 70s, you mostly either became a fan of the Steelers or the Cowboys. And I would ask all of your forgiveness. It's easier to say this over Zoom because I'm not in the room for all of you to boo me. But I was a Cowboys fan. I believed in America's team. And I think you can let me off a little bit because Tony Dorsett was my favorite. And at least there's a tie to Pitt. But when I think about it, I also think about the fact that you guys really handed it to us and beat us up pretty good with the steel curtain. And I think about, when I think about sports and I think about what we're looking to do, and we talk about relationships and we talk about empathy and what we can take out of that, I, of course, think about the Coke commercial in 1979 with Mean Joe Green, somebody who I didn't like until that commercial where he just turns to that kid and tosses his jersey away, and how much I wanted that Coke commercial to be with one of my heroes from the Cowboys. But instead, I had to be a kid, with tears coming to my eyes of, wanting to have him as my hero. But I think about the fact that the resiliency of that team, when I think about the blue collarness of that team and how that actually represented all of you and the region, and what that did. And I also think about the fact that when that team was challenged, that team stepped up. So I think about the stupidness of Hollywood Henderson making the famous quote against Terry Bradshaw before the Super Bowl, and how Terry Bradshaw and the Steelers took it to the Cowboys and said, Terry can spell cat when he's no matter what, even if he's not given the first two letters. But at the end of the day, that resiliency and what the Steelers mean for your region, and the fact that it's a blue collar team and you guys are in a blue collar region, and I very much look at blue collar in a way that I ultimately look at. I come from a blue collar family, so that's me. And when I think about Allegheny County, I think about giving too. And when I look at the Pirates, and especially the Pirates of the 70s, I think about Roberto Clemente. And even though he died tragically in trying to give back to his community in Puerto Rico. But how much that ultimately comes into what you are all about giving and community and what that all means, and how Roberto Clemente was ultimately really one of the great community members and one of the great givers and one of the great people that stood out there to make sure that he never forgot where he came from, and he made sure that people in need were given what they needed, and he stood for that, and he still stands for that. You know, number 21, that he still is out there in his legacy and his family giving back, and the Major League Baseball still recognizing what he does and how ultimately he stands for what we're supposed to be, giving to our community, making sure we take care of our community. And then I think about the fact that when I think especially about my friends in college and how they were so community minded and so region based, I think about the late 70s and the We Are Family Pirates with Willie Stargell and Dave Parker, and that whole theme of We Are Family, and how much that team again dug in and dethroned, the Reds, who had won over 100 games, and just tossed them aside and went on to win the National League pennant and then ultimately into it. And for you all to know, even though I took on the Cowboys as America's team, and that would seem like a gimme, I took on the Red Sox as my favorite baseball team. So it took me a long time before I actually got to see a winning team in baseball. So it wasn't all about just taking on the gimmies. But to resiliency and to Allegheny County, you guys have fought through some tough times. When we think about LEAD and we think about the people that we ultimately work with and we ultimately know that need help, it's resiliency we look for. When we think about a location and a jurisdiction that has a lot to give and a lot to learn from, I think about what you guys have to give. So I think about the tough times that Allegheny has been through, and I think about, we all think about the Rust Belt, and we all think about industry, and we think about the steel towns of Allegheny County and all of the things that you guys have been through. I was reading over 90,000 people employed in steel mills at the height of the steel mill, the steel industry in this country. And the fact that steel mills, there's still a few, but very few people employed in that. And I think about the fact that Allegheny didn't just give up. Allegheny didn't just throw in the towel. Instead, that industry that was once dominated, that the steel mill industry and the landscape, instead, other industries have moved in. So advanced manufacturing, healthcare, energy, financial and businesses that have come in and taken on that new life, and that you guys have built back up. And you guys didn't just give up and say, we're done and we're never going to be able to make it. You guys have actually built back up and ultimately had a renaissance. You guys have had this renaissance period, and that you guys are doing better. But there's still challenges, right? When we think about the criminal legal system, we know about the challenges, and you guys have done your homework. You guys have looked at different things that are happening. And we know that when it comes to the criminal legal system, you guys are in this boat where a lot of the country's in. We're trying to figure out what is it that's going to take it to provide public safety, true public safety, where we're not continuing to do the same thing over and over again. So 42 cents of every property tax dollar is going into the criminal justice system. And is that a smart thing for us? Like, is that something that's making the public safer? You guys know that in your Connect communities, that 38% of the budgets in those communities are spent on public safety. And I don't think anybody would argue that public safety isn't worthy of investing in. It's whether or not that percentage is ultimately the right place to spend it. And I think about my old budget in Albany. When I was responsible for that budget, a third of my budget was the city's budget for public safety. And we all have to look and go, okay, Is that the right amount? And then what does the public safety budget look like? Does that all go into policing? Does that go into the jail? Does that go into alternative programs? Does that go into giving services? Think about the cost of a night in jail, $77.40 for one night in jail. We're getting ready to do our travel, and one of the places we'll be coming is to see you guys. So I was looking up the per diem, the federal per diem rates. So it's $124 is the federal per diem rate for a hotel for the federal government to say we'll reimburse people. So think about that, less than $50 difference between what the federal government will reimburse somebody compared to $77 for a night in the jail. Now, that doesn't mean I'm not thinking we should not treat people well in jail, because we should, but think about what we're spending to put somebody in jail. Is that a wise move? Is that going to ultimately address what it needs to address? And you were all at the table trying to figure that out. We know that there's just the rates of people with unmet mental health issues, with unmet substance use issues, folks in poverty, that are ultimately those rates rising. So even though you guys have had this renaissance, we know that the rates of poverty are still out there, especially in the pandemic, especially with COVID issues we've had over the past 15 months. Those folks are still struggling to gain access to the services they need. So we also know that you guys have this focus on your jail, just like a lot of folks do, especially after the pandemic, but even before it. So I was looking in the paper last night, you guys had, at the height before the pandemic, you guys had about just under 2,500 people in jail. And then in March of 2020, you had about 1,800 as of today in jail. And looking at that population, in New York, we had the same thing, that the Vera Institute came in and did some really good work on what the populations look like in the county jails. And in New York, we had this big dichotomy of what it looked like down in the New York City area and Rikers, and what it looked like in the rest of the state for upstate. You guys look a lot like what a lot of us upstate look like, where we have a whole lot of people that have not had their day in court and we had a whole lot of people that are on probation hold. So you guys had about 35% awaiting trial and about 33% on probation detainers. So how do we look at that, and how do we deal with those populations? Should they all be in jail? Should we have alternatives? How do we ultimately address that? And again, you guys are up to this challenge. You guys are looking at that, because we also know that arrest and jail can actually serve to exacerbate the issues around those untreated behavioral health needs, on trauma. We all know, for law enforcement and everybody else in this room, but law enforcement knows that the folks that we deal with over and over again on the street, there's an underlying issue with folks that we can't get to in the criminal legal system, that when we arrest folks that have had issues throughout their lives and things happen to them, that we're never going to be able to address that in a moment's notice. We're never going to address that by sending somebody to jail for 72 hours and having them come back on the street. We're never going to get to the root cause of the issue. We know of things like adverse childhood experiences. We know the likelihood of folks getting involved in the system based on the more things that happen to them early in life, the more trauma they have happen. And that's not to say everybody that has trauma that happens to them early in life, and everybody who experiences certain things like domestic violence, a parent incarcerated, family that has mental illness, that doesn't make it through school, things like that. Not everybody who has those issues happen to them winds up in the criminal justice system, but a great many people do, and the risk factors are more that you're going to, as well as other issues, as well as medical issues, as well as mental health issues. We know that our jail system winds up being kind of the drop-off system for all the folks that are falling through the cracks. And we know that many times we're having the same contacts with the same people and arresting people multiple times, and we're not seeing any better results. It's the definition of insanity. We do the same thing over and over again and expect different results. The more we talk about pre-arrest diversion and LEAD, I look back in Albany to our first participant. He had been arrested 44 times. He had been convicted 22 times. He was stealing to support an addiction to heroin, and he was ultimately wanted out, and the system was broken. Not just the criminal justice system, but the medical system, the housing system. All the systems have flaws. And the officers had to ask themselves, for this petty larceny, a misdemeanor in New York, that this gentleman is ultimately committing to deal with a severe addiction where he is now using just to keep himself from getting sick. Is a 45th bite at the apple going to all of a sudden magically make this gentleman well? And the answer was no. We have to have a better way. And you guys are all at the table doing this. You guys are at the table saying, what do we need to do? Because ultimately, people get caught up in this never-ending cycle of the criminal legal system. And for many people, there's no way out because we continue to add onto the pile. We continue to make things worse. And that seems kind of crazy to a lot of us. Certainly, it seemed crazy to me when early on in my career, I thought arresting people with substance use disorders, and we were in the height of the crack epidemic. And the crack issues at hand, we were told just go out and arrest everybody that moves, whether somebody's got a crack pipe on them or half a kilo of cocaine, just arrest them and we'll treat everybody the same. And I think we've learned our lesson, but I hope we do. But ultimately, what do? We look at folks that are coming in and out as persistent offenders. And what we don't do is look at those folks, first of all, as human beings. And second of all, we don't look at those folks like, wait a second, is this really a public health issue? Or is this an issue where we need to punish and coerce somebody? And luckily, we have folks like all of you here in Allegheny County that are recognizing that, no, this is a public health issue. That doesn't mean it's not a public safety issue. It just means that we have a public health issue happening and we can treat folks in a much more humane system, in a much different approach where punishment and coercion don't work, but actually treating somebody with the respect and dignity that we need to, and recognizing that we can actually have empathy for this individual and come up with a much more person-centered approach. We can actually do things different. And you guys are ultimately doing this. You guys are recognizing in Connect's report around what Allegheny County needs to do to address these situations. You all said it. There's not one person that was interviewed that I read on that didn't say, like, we're doing this thing every day in our normal system and it's not working. Like, we're not having fewer people that are addicted by arresting people and punishing them. We're not having fewer people with behavioral health issues by trying to coerce people into treatment. Those things aren't working. So we need to do different things. Because when it comes to coercion, like, I'll admit, before I understood harm reduction, like, to me, it would have made sense. Like, well, why don't we force somebody to go to treatment? Like, that seems to make sense. We want people to stop using drugs. Well, when we start realizing that many folks that are using drugs, especially folks that are using drugs problematically, that the issue, certainly there's an issue with the drug, but there's all kinds of underlying issues. There's all kinds of trauma. There might be mental health issues. There's the fact that the person has no home to live in, the fact that the person doesn't have the services they need. And if all we do is try to treat the substance, we miss all those other issues. And ultimately, that's what we need to do. We need to start addressing the other issues. And we'll talk a little bit about harm reduction in a couple of minutes. So last week, we had some great speakers, talked about, really set things up. This has been a great conference. You guys can all say this has been a great conference, minus the Cowboys fan. But when we talk about things like, I want to keep on Allegheny County and focused on you all, but I want to kind of bring up a few things that got talked about last week, because I think it's really important to keep in context of why it's really important to recognize that you guys are looking to do things differently. So we know in the United States that we're 5% of the world's population, but we account for 25% of the world's incarcerated population. Now, I will tell you that I will still argue that we are the best system in the world to a point, but we still try to use punishment as a way to get out of things. So we know that we have to improve that. 25% of the world's incarcerated population is way too much. We know that one of the reasons why we use incarceration, one of the reasons why we arrest people and we punish them, is not just to try to address that person, but it's also to deter other people from committing crimes. So we have law books, we have the penal law, we arrest people, we put them in jail, and we do that publicly, and we do it to try to say to other people, don't do this. This is illegal, this is beyond our norms. If you do this, we'll punish you. So if that's the case, and between 1980 and 1997, we had a 700% increase in incarcerating people for nonviolent drug offenses. Well, if deterrence works, then drug use would have went down. It didn't. It went up. And between 1997 and now, we've had pretty much a flat line of who's in prison. So we went from about 40,000 people to 400,000 people that were incarcerated for nonviolent drug offenses, and it stayed steady. So deterrence hasn't worked. So the fact that we've said, hey, if you commit drug crimes, we're going to put you in jail and we're going to send you away, that hasn't stopped people from using. We also know that the threat, and if we think about this, I don't mean the threat like somebody, like anybody in government's threatening somebody, but we've had this horrific trend of people dying from overdoses from illicit drugs. In fact, from last May to this May, we've seen 81,000 people die from overdoses, whereas we had gone down the past couple of years. The pandemic has certainly set people back. But of course, the other thing that set people back is that fentanyl has flooded the market and isn't just replacing heroin, or at least being mixed into heroin. It's also being mixed into cocaine and methamphetamine. So we're seeing this huge spike. That, the threat of dying, hasn't stopped people from using. So folks still have problematic use and still haven't had this, hey, I'm going to stop because of that. So we know it's deeper than just the drug use. We know that there's folks that are utilizing drugs for other purposes, that they have other underlying issues. There are certainly people that use drugs as a choice. We know that as well. And we know that only about 10% of the people that utilize illicit drugs, only that 10% of those actually wind up with problematic behavior. And many times that's the folks that people are working with on the street, as opposed to the folks that live in neighborhoods that the police don't have to deal with a lot, do things behind closed doors. And because it's behind closed doors, it's not problematic. Sorry, I had to get my drug and caffeine in my system. That doesn't mean that those folks behind closed doors might not have problematic drug use. That doesn't mean they might not have a substance use disorder. It just means it's out of the public eye, so nobody really pays much attention to it. But we also know that the system as it works is problematic. Now, because of the way we look at drug use and because of the way we sometimes label problematic drug use, we also know of those huge racial disparities, and something that we know that we need to address from LEAD. So we need to look at racial disparities. We need to pay attention to that, and we need to try to address it and say, we now have a tool that we can utilize, especially out when it comes to street interdiction, to say, no, we need to look at these disparities, and we need to recognize that if we make diversions the right way, if we include community the right way, we can make changes. So when I talk to officers around the country, some of the things we talk about when it comes to folks they engage with in the community is around mental health and is around substance use. And many times it's about co-occurring disorders. So we know what a lot of the national numbers say. We're talking about 46 million people with mental illnesses, 18 million people with substance use disorders, and then about 8.5 million that have co-occurring disorders. So those are the population that actually went to a doctor. A lot of police officers in the community, the folks they deal with, they haven't been to a doctor. They have no diagnosis. But I get anywhere from 5 out of 10 to 9 out of 10 people that officers are dealing with every day that have some sort of disorder, whether it's actually diagnosed or not. Those are the folks that officers are dealing with. And officers have no answer, because at the end of the day, like we've just talked about, jail, prison, arrest, the criminal legal system just does not deal with things that way. And when we think about it, and we think about that that's not an answer, and we think about that that's not going to be the way to respond to it, well, what are we going to do? We can't just throw up our hands and go the other way. When we talk about racial disparities in the system, especially when it comes to substance use, we can't just throw up our hands and walk the other way. Well, we need a different alternative. And that is what LEAD can help you guys do. And you guys, with all of those challenges, with all of the issues going on, you've chosen to be resilient, right? You have chosen that you're going to do something different, that you know that this is hard work. You know that this is something different. You know that this can be counterintuitive, because like as a cop for 23 years, harm reduction can be counterintuitive, but you know that you can do something different, that you can ultimately make a change. And that change is something that is very much a collective ownership change, is very much including all of your partners, and is very much different. It's a different path. But you guys have this great setup. So the folks at Connect and the folks that we've been dealing with all of you guys, this partnership, you guys are realizing that as a collective group, you guys can make a greater change. And I'm not going to go into the structures of LEAD, but ultimately at the end of the day, later on, we're going to talk about two very specific things in two breakout groups. We're going to talk about the operation work group and the community leadership team. And I'm going to tell you that those two groups are extremely important. The operation work group, working with the folks that are on the ground, making diversions, working with the case managers who are really doing different things and working with individuals, sometimes coming up with strategies that we wouldn't normally think of, is pretty amazing, the work that they do. And the fact that they're working long-term relationships, the fact that they're building relationships with folks that have been removed from society and removed from having relationships with people for a very long time is simply amazing. And then the community leadership team, engaging with our community, listening to our community, being transparent, being accountable, and also listening back and understanding what it is the community needs. Two things that are desperately needed. And we're going to talk more about those later on. The reason why why we are so happy to work with all of you in Allegheny County is because of this fact that you are really thinking through things, you are really paying attention to what's happening, and you are really cognizant of the fact that you can't just throw spaghetti against the wall and see what sticks and whether or not it's done. You are actually recognizing that punishment and coercion don't work, but we also have to think things out. And you guys are recognizing that we need to pay attention to the stages of change. We need to be very person-centered. We need to be long-term case management. And we need to recognize that we can't put a lot of barriers in place for folks. So let me talk for about 2 or 3 minutes about harm reduction, and then I'm going to wrap up. Harm reduction. So let's think about this fact that we're trying to reduce harms that are associated with people's behavior. And we think about this usually in substance use, but it's also the case in a lot of other things, mental health issues, poverty, homelessness. We can apply this to a lot of different things. But it's about meeting people where they're at, figuratively and literally. But it's not about leaving them there. It's about bringing them in steps along the way. It's about recognizing that not everybody is ready, willing, or able to make major changes. But if we make incremental changes, we can actually start to improve that person's life. We can improve the quality of life for the community, and we can improve public safety. It is, when I say figuratively and literally, if somebody's living under a bridge, our case managers and LEAD are going to go meet that person under that bridge. If that person says, I'm not ready to stop using whatever drug it is they use, we're going to accept that and we're going to work with them. Now, if we think about a lot of other programs, once they get to that drug, somebody says, if you test positive for a drug, you're done with our program. And then we're right back in society with no support, with nothing else to help them. So we're looking to recognize that we're meeting that person where they're at. We're not going to focus on that abstinence piece because we're going to recognize that if we start making those incremental changes and build relationships, we're going to be better off. It's very person-centered. It's very much non-judgmental, and it seeks to support that person in identifying what that person wants to do. Think about how we all change. I will tell you that if somebody tries to tell me how to change, besides my wife, I will not listen. Nobody's going to tell me what to do. And that's very apparent. And when I go to a doctor for one of my many issues, and they tell me, well, you need to do A, I'll say, no, I'm doing this. And my doctor goes, great. I'll see you back in 6 months then. Keep on doing that, and we'll see you later. Here's your medication, whatever it might be. So we need to recognize that we ultimately need to listen to people. We need to build relationships. Harm reduction, counterintuitive for a lot of us, but ultimately makes a difference. And I'm going to wrap this up just by telling a quick story. And I know I'm running out of time anyways. We all get very focused on drugs. So we had a young lady got diverted into LEAD. She had overdosed one day. Thankfully, she survived. Officer who was old enough to be her dad was the one that responded to the call. She went to the hospital. He talked to her, left that. There was nothing to prosecute. And at the time, Albany was not doing social contact referrals, so there was no arrest, so there was no diversion to be made. A few days later, that officer came across the young lady in one of the parking lots along one of the areas in the city, and she was just starting to actually inject herself with heroin. So the officer had an option to either arrest her or divert her. He diverted her into LEAD. And at the operation work group, which you guys are going to learn more about a little bit in a little while, the case manager came in and gave the game plan of when they met. So the case manager said, yep, young lady came in, we met over a cup of coffee, we started to talk, and basically the first thing out of the young lady's mouth was, I don't know why I'm really here. I don't know what you think you're going to do for me, but if you're going to tell me to stop using drugs, that's not going to happen. I use every day. That's how I get through a day, and there's nothing more you can do for me. And the case manager, because the case managers are very, very focused on recognizing that it's not about the drug and it's about meeting the person where they're at, unlike probably what I would have done, said, that's fine. Talk to me. What do you got going on in life? So ultimately what came out of it is that that young lady had suffered through some traumatic incidents when she was in middle school. She dropped out of school because of those. And she was dealing with that traumatic incident by using every day. And when the case manager built a relationship, the young lady said to her, I want to get my GED because I've been trying to get a job. I dropped out of school. I can't even check the box that I have a GED and I can't get an interview. So instead of worrying about the drug, the case manager made sure that she had naloxone, made sure she was using safely, but they got a GED and got her a job. And eventually, as that was happening, her use went down and eventually her use stopped because it wasn't about the drug, it was about her traumatic incident. Now she probably needs some longer term counseling when it comes to that incident, the incident itself, and the case manager will continue to work with her on that and deal with that. But if we focused on the drug and if we focused and said, no, you need to go to treatment, she would have never made it through treatment. Or if she did work her way through treatment, she would have been much more at risk of dying when she came out of treatment because, of course, she would have lost her tolerance, but probably would have used the same amount when she came out. So this is about being person-centered. This is about respecting where people are at. And this is about recognizing that trauma is a big part of the folks that we work with. And that the more we build a relationship, the more we respect where they're at, and the more we meet them where they are, the more success we're going to have. And it's very different for us in law enforcement to recognize that and to let the experts tell us what they're going to do. And that was a lesson for the officers in the room that day in the operation work group, to be respectful of the case manager, that they knew what they were doing. And that won a lot of the officers over. Once they found out how that was working and the fact that that young lady now is doing really, really well, that changed a lot of the officers around of saying, you know what, it's time for me to give this an actual the recognition it needs to, that punishment and coercion and focusing on the drug isn't where we need to be. It's about being person-centered, it's about being respectful, and it's about being resilient, because that young lady was resilient, just like all of you are. So thank you all. I look forward to talking to you guys later on today about the community leadership team, and Joellen and the team at Connect. You guys are awesome.